In considering usage of an AED, perform an initial assessment to confirm the patient is in cardiac arrest. If CPR is in progress, stop compressions and ventilations and verify apnea and pulselessness.
Stop CPR. There's no pulse. Continue.
Resume CPR. If CPR is not in progress and the patient has been in arrest for more than a few minutes, perform 2 minutes of CPR before proceeding with the AED. Turn on the AED. If the unit has a tape recorder, turn it on. Attach the device to the patient. Most electrodes include diagrams to show correct placement. Place one electrode to the right of the upper portion of the sternum below the clavicles. Place the other electrode over the ribs to the left of the nipple with the center in the mid-axillary line. Stop CPR. Clear everyone away from the patient and initiate the analysis of the rhythm.
Okay, everybody clear?
The unit will advise you whether to shock or not to shock the patient. Follow the advice of the AED and push shock if indicated.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press
Okay, everybody clear?
After shocking the patient, continue CPR for 5 cycles and then analyze the rhythm again. Shock as indicated. If no shock is indicated, check the patient's pulse. If the patient has a pulse, check for breathing. If the patient has a pulse and is not breathing adequately, provide artificial ventilations with high-flow oxygen and transport. Now let's look at a scenario where the AED advises no shock.
Analyzing heart rhythm. No shock advised.
Check the patient's pulse. If no pulse is present, perform CPR for 2 minutes and recheck the pulse. Reanalyze the rhythm. Deliver shocks as advised by the AED. If no shock is advised and the patient still has no pulse, resume CPR. After a third consecutive no shock advised message, and if there are no ACLS personnel on the scene, transport the patient.